Hello, in this video I'm going to talk about wrist and hand injuries, rehab, and considerations. Starting by talking about the median nerve. So as I mentioned in the last video, a nerve can be impinged or injured anywhere along its path, and it would cause symptoms and signs that happen distal to the site of the impingement or the injury. So the median nerve could be impinged at the neck, shoulder, elbow, or wrist, and could cause the symptoms of carpal tunnel syndrome or symptoms anywhere along the path of that nerve distal to where the injury is. Okay, so carpal tunnel syndrome is when the median nerve is entrapped or injured in the carpal tunnel at the wrist. Could be caused by anything that decreases the space inside the tunnel. So any swelling or inflammation of structures inside that tunnel will decrease the space and cause pressure to be put on the median nerve, which would cause symptoms in the hand. So symptoms include paresthesia in digits 1 through 4 and grip weakness, and it can include pain. So again, we could have these symptoms because there's impingement higher up in the extremity, or it could be truly carpal tunnel syndrome. Okay, metacarpal fracture is usually caused by longitudinal force along the bone, like punching with a fist. So a longitudinal force would be a force that goes in the direction of the long axis of the bone. So here are my metacarpals. So a force that goes in the direction of the long axis of my metacarpals would be most likely to cause it to fracture. Can cause deformity, swelling, and tenderness. And with a metacarpal fracture, you are unable to make a fist. That is too painful, and sometimes there could be enough of a deformity that anatomically you are prevented from making a fist. Okay, metacarpophalangeal joint dislocation. So the metacarpophalangeal joints could dislocate in any of the digits, but it is most common in the thumb, in the first digit, because the thumb is out here kind of on its own and is vulnerable to a lot more forces than those other 4 joints are. So it happens most often in extension and abduction. So it happens most often in this situation where you have extension and abduction and an excessive amount of force into that position. It will cause that joint at the metacarpophalangeal joint to dislocate. Okay, finger fractures frequently cause deformity, but for some reason, a lot of people try to just self-reset phalangeal fractures and don't seek medical attention, or delay medical attention and maybe seek it later or don't seek it at all. So it's kind of a strange thing. There are few bones in the body that, as in general, we tend to think we can deal with ourselves. And for some reason, fingers and toes, a lot of people reset and try to deal with themselves. I don't recommend that. You're more likely to have the bone heal incorrectly in the wrong position, have permanent deformity, permanent dysfunction. So I would always recommend seeking medical attention. It's just odd that for some reason, many of us think we don't need it for a phalangeal fracture. The distal phalanges of the thumb and middle fingers are the most commonly fractured, maybe because they're the furthest out in space, right? The distal phalange of the thumb and the distal phalange of the middle finger, they extend the furthest out in our hands, so maybe they're more likely to be affected. Okay, jersey finger, think athletic jersey, that's where it gets its name. It's an avulsion of the flexor digitorum profundus tendon from the palmar distal phalange. Causes an inability to flex the distal interphalangeal joint. So that last hinge joint, or if I look at this finger, that last hinge joint between my middle and distal phalanges, I wouldn't be able to flex that joint because the insertion, that tendon, ripped off. So I no longer have the ability to flex there because that tendon tore away. So the most common scenario where this happens is that one athlete is holding another athlete's jersey. And that happens in a variety of different types of sports, but where you're trying to grip the other person's jersey or gi or whatever it is that they're wearing. And so you're producing force into flexion for gripping, and the other person is trying to pull away and escape your grip. And so that person is exerting a force that's trying to force you to extend, and you're resisting by producing a force to flex. And the result can be, if there's a great enough force going in either direction, that tendon that's trying to flex that digit, the distal joints of the digit, can just rip right off the bone because it's not strong enough to withstand those competing forces. All right. Thank you for watching, and I'll see you for the next one.